Hi everyone, I want to talk about DVT and pulmonary embolism prevention. Before you can enjoy this presentation, I will advise that you try and check out my previous presentations on venous thromboembolism, which is the combination of DVT and pulmonary embolism. Okay, thank you. Let's go. Before you can prevent thromboembolism, you need to know how it is formed. That's what you call Virchow's Triad. That is, alterations in blood flow, vascular endothelial injury, and hypercoagulable state. That knowledge will help a lot. Okay, let's go. For you to be able to understand everything that I will start talking about, then please kindly revise the risk factors, and you can get that by checking my previous two videos on venous thromboembolism. Please check my two previous videos on venous thromboembolism. You'll get the list of all possible risk factors. Thank you. To prevent deep vein thrombosis that may progress to pulmonary embolism, we can use medications like heparin, low molecular weight heparin, unfractionated heparin, or Fondaparinux. You can also prevent mechanically using intermittent pneumatic compression boots. You can also use graduated compression stocking, venous foot pumps, continued medication until fully moving around, or ambulatory. You can also use aspirin and Xarelto. You have to watch out for pregnancy or watch out for features of DVT in pregnancy. Stop sedentary lifestyle, be active, or increase mobilization. If the family history is present, then as a lady, stop combining oral contraceptives. If it is possible, with possible family history or other risk factors, please, as a woman in premenopause, when you are having signs and symptoms of menopause, seek no hormone replacement therapy. There are other medications that you can use. You can check out my presentation on menopause and you will get the list of other medications you can use apart from hormone replacement therapy. Please work on how to decrease the weight and have good diet. Still on prevention, you can reduce long flights if it's not so compulsory, or when it is compulsory, you can walk around while on the plane. And stopping smoking will be excellent. And if it is heparin-induced thrombocytopenia, you can discuss with your doctor and he or she will work out on alternatives for you. Get treatment for that obstructive sleep apnea and decrease fat intake. You can also treat anemia if you are anemic. If in any way you've contracted tuberculosis, please get treatment and avoid contact if you've not. Steroid usage should be decreased or stopped if possible. Prevention of myocardial infarction and stroke is going to be very helpful, and you can check out my videos on myocardial infarction prevention and stroke prevention. I published them some months back. You should adhere to instruction as per antiplatelets or anticoagulants usage. After sitting for a long time, get up and stretch your legs to prevent DVT. Report any sign of leg swelling and pain promptly. Let that physical examination be done and possible other tests to rule out DVT and prevent pulmonary embolism that could cause sudden respiratory death. Thanks for listening to my presentation. Kindly subscribe to my channel so that you can get all my presentations immediately they are published. Thank you. And before I go, I remember, for you to enjoy this very well, please kindly go over the risk factors again and then match the two videos, the risk factors and preventive measures. Thank you.